Hello everyone, welcome to Simsad Aesthetics. I am a professional esthetician and cosmetologist. As in my previous video about exosomes therapy for hair loss, I have already shared the deep introduction about how do they work and their science. Watch it for best deep science about exosomes. So in this video I will only give you a detailed guide about this treatment for skin rejuvenation. For all skin rejuvenations in combination or comparison with other treatments and more, for skin. So subscribe my channel and watch full video to get best beauty advice. Exosomes are tiny extracellular vesicles secreted by stem cells, packed with growth factors, proteins, and genetic material that play a crucial role in cellular communication. In aesthetic medicine, exosome therapy has emerged as a revolutionary treatment for skin rejuvenation, offering a non-invasive yet highly effective solution for aging skin, scars, and texture irregularities. Exosomes function as biological messengers, delivering regenerative signals directly to skin cells. When applied topically after microneedling or injected into the dermis, they trigger fibroblasts, the cells responsible for collagen and elastin synthesis, to accelerate tissue repair. Section 1. Treatment procedure step by step. Number 1. Pretreatment phase. A typical exosome therapy session involves, Step 1. Initial consultation and skin assessment. Your esthetician or dermatologist will evaluate skin type, concerns, wrinkles, scars, pigmentation, and medical history. Step 2. Pre-treatment preparation, 1 to 2 weeks prior. Avoid sun exposure, retinoids, or harsh exfoliants to prevent sensitivity. Discontinue blood-thinning medications, if advised by physician. Hydrate skin with gentle moisturizers to optimize barrier function. Number 2. Then comes the day of treatment, step-by-step process. Step 1. Cleansing and numbing. Skin is thoroughly cleansed with a medical-grade antiseptic solution to remove impurities. Topical numbing cream, e.g., lidocaine, applied for 20 to 30 minutes to minimize discomfort. Step 2. Delivery method, microneedling or injection. Option A, microneedling with exosomes. A sterile microneedling pen, 0.5 to 2.5 mm needle depth, glides over the skin, creating microchannels. Exosome serum is gently massaged into the skin, penetrating through microchannels. Option B, intradermal injection, for targeted areas. Exosomes are injected into the dermis using ultrafine needles, e.g., mesotherapy technique. Focus on deep wrinkles, under eyes, or scarred areas for precision. Last is the post-application soothing. After the treatment, cooling masks or LED light therapy, red or infrared, is applied on the treated area to reduce redness and enhance absorption by the esthetician. After that, as post-care, you should apply hyaluronic acid or ceramide-based serums to lock in moisture. Section 2. Post-treatment care and recovery. Immediate aftercare after treatment for, first 24 to 48 hours. Apply provided healing ointment, e.g., Vaseline or Cicaplast. Use a mild, fragrance-free cleanser. Sleep on your back to avoid friction. Avoid sun, sweating, or makeup for 24 hours. No swimming, saunas, or harsh skincare, retinols or acids, for 72 hours. After days 3 to 7, it is skin repair phase. On the treated area mild peeling or dryness may occur, normal part of cellular turnover. So introduce sunscreen, SPF 50+, and antioxidants, vitamin C, to protect new skin. Schedule 2 to 3 sessions, 4 to 6 weeks apart, for cumulative results. Annual touch-ups recommended to sustain collagen production. Section 3. Expected results timeline. After week 1, you will feel brighter complexion and improved hydration. After 1 month, visible reduction in fine lines, smoother texture will occur. After 3 months, peak collagen remodeling occurs, scars soften, and skin elasticity enhances. Section 4. Benefits of exosomes therapy. Exosome therapy stands out for its ability to deliver multifaceted improvements without surgery or downtime. Key benefits include anti-aging effects, significant reduction in wrinkles, crow's feet, and nasolabial folds by restoring youthful cellular activity. Scar and stretch mark improvement as the treatment softens hypertrophic scars and atrophic acne scars by remodeling damaged tissue. Hydration and texture refinement, which strengthens the skin barrier, locking in moisture and smoothing rough patches. UV damage repair, which reverses sun-induced photoaging by repairing DNA damage and reducing oxidative stress. Long-lasting results occur. Unlike temporary fillers, exosomes induce natural regeneration, with effects lasting 12 to 18 months. Section 5. Risks of exosomes therapy for skin. While exosome therapy is generally considered safe with minimal side effects, it's important to be fully informed about potential risks before undergoing treatment. Risks include: most patients experience mild redness and slight swelling immediately after treatment, similar to a sunburn, which typically resolves within 12 to 48 hours. Some may notice minor bruising at injection sites when this delivery method is used, particularly in delicate areas like under the eyes. Temporary skin tightness or light peeling may occur 2 to 4 days post-treatment as part of the natural skin renewal process. Although rare, allergic reactions could occur if the exosome solution contains certain additives or preservatives. There's a minimal infection risk if proper sterile techniques aren't followed, emphasizing the need for qualified practitioners. Patients with darker skin tones may be more susceptible to temporary hyperpigmentation if strict sun avoidance isn't maintained. Section 6. Ideal candidates for exosomes therapy. Exosome therapy suits individuals with fine lines, sagging skin, or loss of facial volume, acne scars, surgical scars, or melasma, dull, dehydrated skin lacking responsiveness to topical products. However, it is not suitable for pregnant or breastfeeding women due to insufficient safety data in these populations. Those with active skin infections like cold sores or severe acne breakouts should postpone treatment. Cancer patients or those with a history of malignancy should consult their oncologist first due to theoretical concerns. Section 7. Clinical and scientific evidence. Research supports exosomes efficacy. A 2020 Journal of Cosmetic Dermatology study showed a 40% increase in collagen density after 3 sessions. Trials note improved skin elasticity by 32% and hydration levels by 28% compared to placebo groups. Section 8. Cost and maintenance. Pricing ranges from $800 to $2,500 per session, depending on the clinic and delivery method. Sessions recommended are 2 to 3 treatments spaced 4 to 6 weeks apart for optimal results. Maintenance demands annual touch-ups, sustain collagen stimulation. Section 9. Treatment science for acne scars and under-eye darkness. For acne scars, exosomes deliver powerful growth factors like TGF-beta and VEGF when applied after microneedling or injected into scar tissue. These bioactive molecules work synergistically to stimulate fibroblast activity for increased collagen 1 or 3 production, filling depressed scars. Promote improving blood flow and nutrient delivery to damaged areas, and modulate inflammation, reducing post-acne redness and hyperpigmentation. However, for under-eye darkness, exosome therapy combats under-eye concerns through 3 key mechanisms. Collagen reinforcement thickens the dermis to reduce visible vasculature. Improved microcirculation diminishes dark discoloration by enhancing blood vessel health, and natural tissue regeneration provides subtle volume restoration without artificial fillers. Patients typically see brighter, firmer results within weeks, with optimal improvement emerging after 2 to 3 months as collagen remodeling reaches its peak. Section 10. Exosomes versus other skin treatments. PRP, platelet-rich plasma. While PRP relies on the patient's blood growth factors, exosomes offer a more potent, standardized concentration of regenerative molecules. Laser resurfacing. Lasers remove outer skin layers, whereas exosomes rebuild from within without thermal damage. Botox and fillers. These provide temporary muscle paralysis or volume, while exosomes address aging at the root cause. Final verdict. Exosome therapy is best for those avoiding surgery or injectables, those patients with stubborn scars or UV damage, and anyone seeking preventive anti-aging in their 30s plus. I hope you liked this video. Drop your questions below, and don't forget to like and subscribe for more cutting-edge beauty science.